Did you know that a small butterfly-shaped gland in your neck has the power to dictate the pace at which your body operates? Yes, we're talking about the thyroid gland, an unassuming powerhouse that controls everything from your metabolism and energy levels to your mood. Its influence is vast and its proper function crucial for our well-being. Today we're embarking on a journey into the world of thyroid health. We'll cover major thyroid disorders, their symptoms, diagnostic methods, treatments, and share invaluable tips for nurturing your thyroid health. Stay with us as we navigate through this vital aspect of your health, aiming to empower you with knowledge and solutions. Understanding the thyroid gland. The thyroid gland, nestled at the base of your neck, is often likened to the conductor of the orchestra that is your body. It produces hormones, mainly thyroxine or T4 and triiodothyronine or T3, which in this analogy would be the music that tells various parts of your body how fast or slow they should go. These hormones influence your metabolism, affecting how your body uses energy, and they play key roles in regulating weight, energy levels, skin health, and even your mood. The significance of thyroid health affects much more than just your physical well-being, impacting your mental and emotional health as well. Because of this, maintaining a balanced thyroid function is essential for a harmonious and healthy life. Major thyroid disorders. Hypothyroidism. Hypothyroidism is characterized by an underactive thyroid gland that fails to produce adequate amounts of thyroid hormones. This deficiency can disrupt the normal balance of chemical reactions within the body. The condition can stem from a variety of causes, including autoimmune disease, radiation therapy, thyroid surgery, and certain medications. Hypothyroidism is more prevalent in women, particularly those older than 60 years. Symptoms. The symptoms of hypothyroidism start subtly and are often mistaken for the normal signs of aging. Early symptoms can include fatigue and sluggishness. As the metabolism continues to slow, more obvious problems may develop, such as noticeable weight gain, increased sensitivity to cold, constipation, dry skin, puffy face, hoarseness, muscle weakness, elevated blood cholesterol levels, painful, stiff, or swollen joints, muscle aches and stiffness, fatigue, and heavy or irregular menstrual periods. Treatment. Treatment for hypothyroidism is lifelong and involves daily use of the synthetic thyroid hormone levothyroxine. This oral medication restores adequate hormone levels, reversing the signs and symptoms of hypothyroidism. Patients typically notice an improvement in symptoms within a few weeks. Regular TSH tests are critical to ensure the adequacy of the dosage, which may be adjusted periodically. Outlook. The outlook for individuals with hypothyroidism is excellent, as it can be easily controlled with medication. It is crucial, however, for patients to take their medication consistently and attend regular follow-up appointments with their healthcare provider to adjust the dosage as needed. Hyperthyroidism. Hyperthyroidism occurs when the thyroid gland produces too much of the hormone thyroxine, accelerating the body's metabolism significantly. This can cause sudden weight loss, rapid or irregular heartbeat, sweating, and nervousness or irritability. Several conditions can lead to hyperthyroidism, including Graves' disease, Plummer's disease, and thyroiditis. Symptoms. Symptoms associated with hyperthyroidism include heart palpitations, increased heart rate, unexpected weight loss, increased appetite, nervousness, anxiety and irritability, tremors in the hands and fingers, sweating, changes in menstrual patterns, increased sensitivity to heat, and more frequent bowel movements. Enlargement of the thyroid gland, known as a goiter, may also occur. Treatment. The treatment options for hyperthyroidism are diverse, including radioactive iodine, anti-thyroid medications, beta blockers, and surgery. Radioactive iodine is a common treatment and works by destroying the cells that produce thyroid hormones without affecting other tissues. Anti-thyroid medications prevent the thyroid from producing excessive amounts of hormones. Beta blockers can relieve rapid heart rate and prevent palpitations. Outlook. With prompt treatment, hyperthyroidism is generally controllable. Most individuals respond well to treatment, which is designed to significantly reduce symptoms quickly. Long-term prognosis depends on the cause, with some treatments leading to hypothyroidism requiring ongoing medication. Hashimoto's thyroiditis. Hashimoto's thyroiditis is an autoimmune disorder in which the immune system attacks the thyroid gland, gradually destroying its ability to produce hormones. It often leads to hypothyroidism and is the most common cause of thyroid gland failure. Symptoms. The initial symptoms of Hashimoto's may be very mild and include fatigue and sluggishness. As the disease slowly progresses, the thyroid may become more visibly enlarged goiter, which can further exacerbate feelings of fullness in the throat or trouble swallowing. Over time, as the thyroid's ability to produce hormones decreases, more overt symptoms of hypothyroidism may develop. Treatment. Treatment for Hashimoto's disease typically involves daily medication to replace lost hormones. This may initially involve monitoring until hormone levels fall below normal levels. Long-term treatment with levothyroxine, which is synthetic thyroxine, usually results in noticeable improvements. Outlook. While there's no cure for Hashimoto's thyroiditis, the prognosis with treatment is generally very good. Hormone replacements can normalize thyroid function, allowing individuals with this condition to lead a normal life. Regular monitoring and adjustments in treatment are essential. Graves' disease. Graves' disease is an autoimmune disorder leading to overproduction of thyroid hormones causing hyperthyroidism. It is the most common cause of hyperthyroidism in the United States and involves an abnormal immune response that causes the thyroid gland to produce too much thyroid hormone. Symptoms. Graves' disease symptoms are similar to general hyperthyroidism but may also include bulging eyes, also known as Graves' ophthalmopathy, vision problems, red or swollen skin, and a rapid or irregular heartbeat. The eye problems can lead to photophobia, eye pain, and even vision loss if untreated. Treatment. Similar to other forms of hyperthyroidism, treatment options include radioactive iodine, anti-thyroid medications, and surgery. Additionally, beta blockers may be used to manage symptoms. For eye issues, corticosteroids, prisms, and sometimes surgical interventions are necessary. Outlook. The overall prognosis for Graves' disease is good, though eye symptoms can progress even after hormonal balance is restored. Lifelong treatment and monitoring are often necessary to manage the disease effectively. Thyroid nodules and goiters. Thyroid nodules are solid or fluid-filled lumps that form within the thyroid. Most are benign, but a small percentage can be cancerous. A goiter refers simply to the abnormal enlargement of the thyroid gland and can occur in conditions involving hypo or hyperthyroidism, or even when the thyroid is functioning normally. Symptoms. Most thyroid nodules and goiters are not symptomatic. When symptoms do appear, they may include a visible swelling at the base of your neck, difficulty swallowing or breathing, hoarseness, and in the case of nodules, the feeling of a lump in the throat. Treatment. The treatment depends on the type, size, and condition of the nodules or goiter. Benign nodules may simply be monitored over time. If they are large, cause symptoms, or are cancerous, treatments may include radioactive iodine, surgery, or alcohol ablation. Outlook. The outlook for benign thyroid nodules and goiters is generally excellent. Even when surgical intervention is necessary, the procedures are typically successful in resolving symptoms and cosmetic concerns. Thyroid cancer. Thyroid cancer is considered one of the less aggressive cancers and is highly treatable. It typically develops in the cells of the thyroid gland responsible for producing hormones. Symptoms. Early thyroid cancer often does not produce symptoms. As it progresses, it may cause pain in the neck, difficulty swallowing, changes in voice, persistent cough not due to a cold, and noticeable lumps in the neck. Treatment. Treatment generally involves surgery to remove all or part of the thyroid gland, followed by radioactive iodine therapy to destroy any remaining cancerous cells. In some cases, external radiation or chemotherapy may be necessary. Outlook. The prognosis for thyroid cancer is generally very positive, with high survival rates, especially when caught early. Mild thyroid infection. Mild infections of the thyroid, such as subacute thyroiditis, typically occur after a viral infection and are relatively rare. These infections cause inflammation of the thyroid, affecting its function temporarily. Symptoms. Symptoms include pain in the thyroid region, fever, fatigue, and at times, symptoms of both hyperthyroidism and hypothyroidism as the thyroid initially releases hormones into the blood followed by diminished activity. Treatment. Treatment usually involves pain relief medications, anti-inflammatory drugs, and occasionally corticosteroids. Thyroid function often returns to normal after the infection subsides. Outlook. The outlook for a mild thyroid infection is excellent, with most individuals seeing a full return to normal thyroid function without long-term effects. Once a potential problem with your thyroid has been identified, There are several different tests that you may need to undergo to identify the exact issue you're facing. Diagnostic methods for thyroid disorders. 1. TSH or thyroid stimulating hormone test. This fundamental screening test measures the level of TSH in the blood, crucial for diagnosing both hypothyroidism and hyperthyroidism. Elevated TSH levels typically indicate hypothyroidism, whereas low levels suggest hyperthyroidism. 2. Free T4 and T3 tests. These tests measure the levels of active thyroid hormones in the blood. High levels usually confirm hyperthyroidism, while low levels are indicative of hypothyroidism. 3. Thyroid antibody tests, useful for identifying autoimmune thyroid diseases such as Hashimoto's thyroiditis and Graves' disease by detecting the presence of thyroid autoantibodies. 4. Radioactive iodine uptake test. This test involves ingesting a small amount of radioactive iodine and measuring how much is taken up by the thyroid gland from the blood. It helps in differentiating between different types of thyroid disease, particularly in diagnosing Graves' disease. 5. Ultrasound. The primary imaging tool for examining the thyroid gland, used to detect and evaluate the size, shape, and the presence of nodules or goiters. It can help distinguish between benign and potentially malignant nodules. 6. Fine needle aspiration biopsy. Critical for evaluating suspicious thyroid nodules detected during the ultrasound. This procedure involves extracting a small sample of cells from the thyroid nodule for microscopic examination to determine if it is benign or cancerous. 7. ASR and CRP. Blood tests for erythrocyte sedimentation rate and C-reactive protein are not specific but can indicate the presence of inflammation associated with thyroiditis or subacute thyroiditis. 8. Imaging tests. Additional radiographic tests such as CT scans or MRI may be utilized to assess the extent of large thyroid cancers or to check if the cancer has spread beyond the thyroid. These diagnostic methods are integral to accurately identifying and effectively managing various thyroid disorders, guiding the approach to treatment and ongoing monitoring. Preventative tips for thyroid health. Maintaining thyroid health involves more than just managing symptoms or treating conditions. Here are some tips on preventive measures that can help support your thyroid function and prevent potential disorders. 1. Adequate selenium intake. Selenium is a trace element that is vital for the proper functioning of the thyroid gland. It contributes to the conversion of T4 into its more active form, T3, and protects the thyroid gland from oxidative damage due to its role in antioxidant activity. How can I get it? Selenium can be found naturally in a variety of foods. The richest sources include Brazil nuts, which contain such high levels that eating just 1 or 2 a day can meet the daily requirement. Other good sources are fish, shellfish, turkey, chicken eggs, and mushrooms. It's important to consume selenium in moderation, as excessive intake can lead to selenium toxicity, which can cause symptoms similar to those seen in thyroid imbalance, including hair loss, gastrointestinal upsets, fatigue, and irritability. 2. Stress management. Chronic stress can have a significant impact on thyroid function by altering hormone levels and immune function, potentially triggering or exacerbating thyroid disorders. Strategies for management. Effective stress management techniques can vary from person to person, but common methods include regular physical activity, which can help stabilize mood and improve overall health. Meditation and mindfulness practices are also effective in reducing stress and have been shown to decrease cortisol levels, a hormone that can affect thyroid function. Ensuring adequate and quality sleep each night is crucial, as sleep helps regulate stress hormones and supports overall hormonal balance. 3. Avoid excessive soy. Soy contains isoflavones, which are compounds that can interfere with thyroid hormone production and absorption if consumed in large quantities. This is particularly crucial for those who have an existing thyroid condition or are taking thyroid hormone replacements. Guidelines. While moderate consumption of soy products like tofu, soy milk, and edamame is generally considered safe, it is wise to avoid consuming them in large amounts or around the time of taking thyroid medications. Soy may hinder the absorption of thyroid medication, so it's recommended to maintain a gap of several hours between ingesting soy products and thyroid pills. 4. Regular neck checks. Early detection of thyroid issues can often start with a simple physical examination of the neck. Changes in the thyroid gland, including swelling, nodules, or enlargement, can sometimes be detected through regular self-exams. How to perform a neck check. Stand in front of a mirror and observe the lower front area of your neck, above the collarbones and below the voice box. Tilt your head back slightly to stretch the area. Swallow a drink of water and watch for any bulges, protrusions, or unusual appearances in this area as you swallow. Repeat this process several times to check from different angles. Any signs of bulging or lumps should be evaluated by a healthcare professional. 5. Balanced iodine intake. Iodine is essential for thyroid hormone production. Both iodine deficiency and excess can lead to significant thyroid dysfunction and can trigger conditions such as goiter and various forms of thyroiditis. Managing your intake. The key to iodine consumption is balance. Iodized salt is a primary source in many diets, but you can also obtain dietary iodine from dairy products, seafood, and seaweed. People with existing thyroid conditions should manage their iodine intake according to medical advice, as excessive iodine can exacerbate certain thyroid diseases. By incorporating these preventive measures into daily routines, you can effectively support your thyroid health, reducing the risk of thyroid disorders and maintaining your overall well-being. By understanding the signs to watch for, the available diagnostic tests, and the range of treatment options, you can engage actively in your healthcare decisions, working closely with your healthcare providers to manage your thyroid health effectively. Whether dealing with common thyroid issues or more complex conditions, the goal remains the same: to restore balance, enhance well-being, and improve the quality of life. Remember, every step you take towards understanding your health is a step towards a healthier, happier you. If you found this video enlightening, consider subscribing to our channel for more health content designed to empower and inform. Share this video to spread awareness and join us in our mission to demystify health and promote well-being.